Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is focused around anxiety and depression and the role of social media in elementary and the middle schoolers. I have presented couple of videos on what goes on in the mind of the adults, the high schoolers with the abruptive behavior, and they are all linked to Bloomfield Township TV Health Talk. Today, I have focused my attention mostly in what happens in the preschoolers and the elementary middle schoolers. So this is what we have been noticed during the past several weeks and even before. Lot of abruptive health-related behaviors have been noted in the elementary and the middle schoolers. So this present video presentation is focused on the elementary and the middle schoolers. So I'm going to start with anxiety. What goes on with our little kids, the one they go to elementary and then they go to middle school. Why do they become anxious? There are several factors that causes their abruptive behavior, such as early childhood trauma, economic distress in the family violence, a prolonged isolation during the pandemic era, and reliance on the social media, plus these kids are failing school grades due to irregular attendance at the school. These are some of the major reasons that starts this abruptive behavior among the school age children. Second slide, please. What are the current statistics? I went through these statistics on childhood anxiety. However, this is changing every year. Starting from 2016 to 2019, 4.4% of children aged 3 to 17 were diagnosed with depression. Approximately 9.4% of children ages 3 to 17 suffered from anxiety. And as I can say, every year this whole thing is changing. It is normal to have some anxiety. They may feel anxious. However, this anxiety sometimes can get accumulated in their mind, and that's how it gets aggravated. So anxiety disorder goes beyond the regular nervousness. That includes anxiety interferes with the ability to function, and when something triggers the emotion. And it is difficult. However, there are several effective treatments that I'm going to go at the end of my talk. Next slide, please. So the anxiety during early childhood could manifest. How early? As temper tantrum, like little kids, they show their temper, they cry a lot, they have a separation anxiety, school phobia, such as they don't want to go to school, and somatic complaints like shortness of breath or vomiting. So depressive episodes in their mind, they follow with the negative thoughts, and they are manifested with their changes in the eating habit and the sleep pattern. Sometimes, they are feeling worthless, and they don't want to go to school. They want to stay home, and this further aggravates their emotions and their anxiety and depression. Next slide. So briefly, right now, I'm going to tell about the social media, but then later on, I'm going to explain more about what are the clinical manifestations. There are a role of social media being socially connected. They're socially being connected to the peers, family, school counselor, and this can help easing the anxiety in them, even when they are middle schoolers or they are elementary schoolers. Today, many of us rely on the social media platform, and the social media platform that includes, I've shown it in a diagram, Facebook, Twitter, Snapchat, YouTube. However, it's worth to know that the social media can never substitute for a real human contact. So now I'm going to talk about just a next slide, please. So contacting a real person, such as a counselor, close friends, parent, they can trigger the hormone that reduces the stress in them and bring positive thought. The positive sides of social media include stay updated with the family, friend, raising awareness on important issue relevant to your health, and also finding outlets for your creativity, discover a valuable knowledge. So initially, like I mentioned before, panic attacks, where big temper tantrum, panic attacks leads to the phobias, like fear of something that I'm going to talk later on. So what happens when they have a panic attack? They experience a sweating, heart palpitation, chest pain, feeling of choking and all that. The panic attacks are very upsetting because people have to have a lot of panic attacks. They are also very much afraid of what will happen in the future. What are the phobias? Next slide, please. So now this is the same thing like I mentioned before. That is, there's a strong link between heavy social media, depression, self-harm, suicidal thoughts, and drug abuse. Social media addiction includes seeing others in a better situation and getting depressed. This triggers self-esteem issue, anxiety that could cause them to an abnormal behavior. There has been a lot of researches that have been done on this issue, and at the end of my lecture, I have included a bibliography. A study at Pennsylvania University has found there is a high use of online chat group that can increase the social isolation and sadness and feeling of loneliness. Next slide, please. So I will go through this slide at the end, but however, since this is there, I'm going to let you know the role of parents in helping their adolescent, like an open communication with their children, trying to understand and value their sentiments. Very important for the parents to realize. Home situation is very, very important in the mind of a growing child whose the frontal part of brain has not developed at this. They have a hypothalamus area with amygdala, and that controls their impulsive behavior. Allow for emotional support for themselves while they are helping their own kid. Very important fact is a nutritious diet with the vitamins, minerals, can help reduce the anxiety. Fruits and vegetables, healthy snacks are vitamins and are all great way to stay healthy. Next slide, please. There are more strategies to relieve anxiety and depression in the adolescent. For example, there is behavioral therapy, exercises like deep breathing, meditation, socializing, and seeking help from the family practitioners all can help. Next slide, please. So, before I go to this present slide, toxic stress syndrome, I like to go through the different manifestations of the anxiety in the young age group. What are phobias? Phobias are intense fear of certain situation or object. And some of these fears may make sense, such as they have a fear of snake or anything. Like other anxiety disorder, you can have, for the parents, lot of time avoid situation that trigger their phobia. A specific phobia, like a simple fear of a particular object in a situation. Certain phobias include like fear of animals, blood, flying, height, and injection. What is social anxiety disorder? The healthcare providers, they used to call this condition a social phobia. You may have an overhaving worry and self-consciousness, daily worry about situation, what is happening with them, with the social anxiety. So now you have another definition of phobia is an agoraphobia, when there is an intense fear of being overwhelmed or unable to get help, such as when the child goes to an enclosed space, lights up crowd, open space, places outside your home, public transportation. Now, another issue they have in that young age is separation anxiety, like going to school away from their parents, and that also has a lot to do. The older children, and by the time they reach high schoolers, they get over this. But during the middle school, these kids, they are very much afraid of separation anxiety. How common are anxiety disorder? The anxiety disorders are very, very common. It is normal for the children to have some amount of anxiety, worry about that. But when this anxiety persists them, it later on becomes harmful for them. When thinking about your child's anxiety level, getting stuck is a key. It separates the regular worries of the childhood from the anxiety disorder that needs a professional help. If anxiety or worry interferes with your child's ability, it may be time to seek help. So what are the causes? In simple word, I have included chemical imbalance in their brain, environmental factor that can trigger an anxiety disorder, hereditary factor also very important. Symptoms of anxiety disorder: cold, sweaty hand, dry mouth, nausea, shortness of breath. The mental symptoms, persistence of this anxiety syndrome leads to feeling panic, fear, uneasiness, nightmareness, repeat thoughts, flashback of any traumatic influence they have, and also a behavioral symptom that can be easily picked up by the parents at the school, and that includes the inability to stay still and calm, a ritualistic behavior such as washing hand repeatedly. So all these all these manifestations, these are the clinical manifestations of the anxiety that starts very early in the childhood. I like to talk about the part of the brain that triggers the stress response in the children, adults, is amygdala. And this is a little almond-shaped structure, almond-shaped structures. It is present around the hypothalamus area. And anytime it becomes overactive during an acute situation, while the other part of the brain that is governing memories, learning, good decision making are located in the prefrontal cortex. Like in children, the prefrontal cortex brain development it takes some time to develop. However, the limbic system with the hypothalamus area that reacts to any abnormal behavior is more active. So what happens, these kids, they loses power of thinking and decision making. This combination leaves a child, adolescent, exaggerated abruptive behavior leading to chronic anxiety, learning disorder, and poor skill. Next slide, please. So these are the bibliography. Again, I have got for you guys. Next slide, please. Next slide. Okay, this is one thing that is just came in the recent journals, and I have given the bibliography. What is a toxic stress syndrome causing stress, anxiety, depression? A concept, it has been developed by a National Scientific Council on Developing Child, reveals a stressful body response to negative, sad incidents, tragedies in the family, domestic violence during early childhood, leaving an impact on developing an abruptive behavior and depression in them. Next slide, please. Okay, I have already talked about this one. I'm sorry, it has been. So now so far as the treatments are concerned, how to early recognition of the stress in the children are very, very important. And for the parents, the role of parents are what we do to help them. Explore the stress management. Learn the ways how these kids can manage the stress. Join a support group. Several children at the school counselors with the kids with the similar issues, they have a group therapy. Get educated. Learn about the specific types of anxiety disorder you have so far, so you feel more in control of limit. For the children, it's good to know that limit the caffeine intake or cokes or something. So for another issue, I don't want to go into detail. Another issue, there is a research came from the Cleveland Clinic, and today a recently published article in the Journal of American Journal of American Association, as well reported at the CNN, says that the middle schoolers, they are more and more getting to the habit of using the over-the-counter drugs, and also the drugs that are being given for the attention deficit disorder. Several children in the preschool and middle school, they have a history of attention deficit disorder, and they are on Adderall and other medication. However, these medications have been used by these kids, and that causes a sympathetic hyperactivity in them, leading to hyperactive behavior, getting high. And these are before it used to be the use of fentanyl opioid, but a recent survey has shown that now the use of attention deficit disorder medications like Ritalin, Adderall, and other ones has become more and more prevalent among our children. So I have included that in the bibliography, more details about it. So how can we how do you present the final thing? How do you present all this? Check out the medications, talk to the healthcare provider or the pharmacist before taking any of the over-counter medication, limit caffeine, live a healthy lifestyle, exercise, high diet, like I mentioned before. Seek help. Very important to get a counseling, seek help. And if there is any serious problem, always try to get some help from the psychiatric issue. Most of these children, as they grow older and older, they get over all this. By the time they reach the high school, they know exactly by the time they are ready to graduate, they already have a sense of what is good for them and what is not for them. But I have focused more attention on this middle schoolers, how to nip this incidence in the beginning. Early recognition, early diagnosis of this anxiety disorder in the children helps in raising a healthy child, and with all the good motivations in them to achieve their goals in their life. This is the end of my slide presentation, and I just put up some footnotes about how do you achieve success in the STEM program. STEM program is the one that has that is study math, science, and how do you achieve how do you do that? So all the schools, schools have this program of study math, science, and math, science, and computing, which is very important in this modern era. So children, attention, it is always should be focused and motivated from the very beginning to achieve their aims, their goals in life by getting themselves more involved in this STEM programs. How do you achieve success in the program? Increase the academic profile of each entering class based as measures such as SAT score, AP classes. Develop and promote attractive inspiration message about the STEM program. Discipline at school is very, very important. Increase the out-of-state recruiting, expand the financial package for a high-ability out-of-state student, provide it's very important to provide an unified student support services, including mentoring, tutoring, and advocacy. Engage more senior students as mentors for entering students. Successful example is to have a mentor, a high schoolers for a middle schoolers as a mentor who can lead them through their academic performance. And this could take place as expanding the services of existing student access, transition, and success. That is called a SATS program. Under the new umbrella center, which is called Student Success, examine ways to enhance the success and reach out to the programs, such as in women in science, women in engineering, minority engineering program, and more. So by having a final advice for our students is by stay focused, know your motivations, and stick to the motivations in life. What is the role of parent and the students too? As parents get involved with your children's activities and schoolwork, since they are in elementary, middle, and high school, emphasize on their good habit, stay focused, and encourage them to study hard. Sincerely discourage their use of electronics, iPhone, video games, and also encourage them in the summer sports activity and be a role model for them. Just remember, I just made this up myself, the fact that an apple does not fall too far from the tree. If the parents and the caretaker themselves are motivated, there is more success in motivating their children to achieve a high goal. So this is the end of my talk today, and I didn't have too much time to focus other issue, and then we will do it during my next series. Thank you very much. I like to thank our viewers for watching me on my health talk, and the topic is anxiety, depression in the young age group, like the elementary and the middle schoolers. And this is where I have focused my presentation on it. Thank you very much. I like to thank our producer, our camera crew for helping me produce this video. Thank you again.